Bocinek says there are basic steps governments need to take to tackle torture.
Conducting effective medical investigations, ensuring that lawyers are able to visit clients in detention and do so immediately, making sure that family members have access to their relatives.
In Brazil, 80% of respondents to an Amnesty Commission survey said they feared they would be tortured if detained by police, the worst performer out of the 21 countries surveyed. In Nigeria, 50% feared torture if arrested. Again, Justin Ijeoma.
Officers that perpetrated this act, none of them are brought to book. The level of impunity in Nigeria and some part of Africa is really getting out of hand.
In the Amnesty survey, 3 in 4 people in China and India said torture was sometimes needed to protect the public. The lowest figure was in Greece, where just 1 in 10 respondents thought torture sometimes necessary. Henry Ridgewell for VOA News, London.
Well, this week, Africa 54 is focusing on successful women on the continent. Thuli Madonsela is South Africa's public protector, and she has grabbed headlines recently for exposing government wrongdoing. She even speared the president in a corruption scandal. Time magazine named Miss Madonsela as one of its 100 most influential people. VOA's Anita Powell has the story of South Africa's most powerful woman.
Thuli Madonsela never expected fame, coming from a humble upbringing in the then-segregated township of Soweto. She started her career as a teacher, but she became South Africa's most powerful public figure when she issued a scathing government report on the president.
Once there was authority, the authority was exceeded.
Madonsela is South Africa's public protector, a job she has performed with surprising vigor since President Zuma appointed this lawyer in 2009. But her calm demeanor belies a reputation as the most tenacious person to ever hold the office. Her March report to Mr. Zuma concluded he misused $23 million of public funds for upgrades to his private home.
I'm also requesting the President to pay a reasonable percentage of the cost of the measures.
Her courage has won her many fans, including Nobel laureate Archbishop Desmond Tutu. A 2013 poll found 64% of South Africans trust her, whereas only 45% trust politicians. Anti-corruption activist David Lewis says Madonsela sets the gold standard.
So she has achieved the status, and deservedly so, of an icon defending the South African Constitution and delivering justice. And that's great.
But for Madonsela, it's the little victories that matter.
The cases that I enjoy most are the administrative failures, when you see a smile on somebody's face after you have unlocked a service that they deserve.
She says naming corrupt officials doesn't give her happiness.
It is said to find somebody guilty of corruption. It is said to suggest to an institution, as I said about 2 days ago, that somebody has to be disciplined and possibly fired. I don't necessarily enjoy that, but I have to do it because if we don't do that, the systems are going to collapse.
Her Zuma report has provoked the African National Congress Party to call for her resignation. But opposition leader Helen Zille says Madonsela's role is critical and her honesty sadly rare in politics.
She's the poster woman of what an independent institution in a democracy should be.
Madonsela is unfazed by criticism and veiled ANC political threats.
However, members of my family do worry. Sometimes they worry more than me about these security issues, especially whenever I'm dealing with the difficult cases.
She says her career, including a role in writing South Africa's constitution, has left her with only one regret.
I don't regret not going to Harvard. Of course, I would have loved to do both constitution drafting and going to Harvard. The only regret I have as a human being is that because I've always combined community work with my professional work, I haven't had enough time to be there for my children.
Thoughtful, modest, soft-spoken, hardly a recipe for success. But Thuli Madonsela uses those qualities to speak truth to power. Anita Powell, VOA News, Pretoria, South Africa.
Well, we want to know what you think about Africa 54 and the stories we cover. Join the conversation on Facebook. The address is Africa 54. And check out our headlines 24/7 on voaafrica.com. Next, new efforts to make delivering a baby a safe experience. Lenore Modou is next with our health report. Time now for our health report. Joining us now is Africa 54 health correspondent Lenore Modou with new information on global water and sanitation. Lenore?
Hello, Laurel. A joint report by the World Health Organization and the UN Children's Fund, UNICEF, says more must be done to close the gap between the billions who have access to improved water and sanitation and those who do not. The report presents estimates from 1990 to 2012 titled Progress on Drinking Water and Sanitation, 2014 Update. It says 2 billion people now have access to improved sanitation and 2.3 billion people have access to safe drinking water. However, though, more than 700 million people still need access to good drinking sources. Half of these people live in sub-Saharan Africa. Bruce Gordon is the WHO Acting Coordinator for Water, Sanitation and Health.
8 out of 10 people without access to an improved water source are still living in rural areas. And within urban areas, we're seeing, for example, also on drinking water, we're seeing that many of the poor people in cities have no choice but to access water in sort of ad hoc ways through pay-per-go kiosks, while the wealthy are able to access their water through a pipe into the home system. Overall, we've got to do something about these populations that are hidden in the corners, about the vulnerable and the marginalized. So unless countries start putting together monitoring processes to understand where people are getting their water and where they aren't, who's getting them, are finances going in the right direction?
The report notes poor sanitation and contaminated water are linked to the spread of diseases such as cholera, diarrhea, and typhoid. Now imagine this, a pregnant woman struggling through labor for days without medical assistance. This is a reality throughout the developing world. And for many women, well, the result is obstetric fistula, a horrifying condition that often leaves them ashamed and childless. This month, global experts are focusing on efforts to treat and stop this preventable birth injury. VOA's Khalil Gay reports from Addis Ababa.
Women living with obstetric fistula, survivors of prolonged childbirth that causes a hole in the birth canal and almost always a stillborn baby. The results? Constant bowel and urinary incontinence. Dr. Mulu Muleta's work is supported by Women and Health Alliance International in Gondar, Ethiopia.
This woman who have suffered has to be treated and they have to regain their health so that they can live with that dignity.
This happened to me because of childbirth. I've been leaking for 18 years. My husband left me and I rented a house, but the owner kicked me out because of the smell. I never used to sleep because of the condition I was in. My heart was not at peace.
Dr. Catherine Hamlin leads the Addis Ababa Fistula Hospital.
These patients broke our hearts. They lost everything, their femininity, their money, their husband, their family. They were outcasts from their society.
The United Nations reports that in developing countries, more than 40% of women give birth without skilled birth attendants. There are not really enough health workers trained to perform emergency cesarean sections when a baby is too big or the birth canal too narrow. Comprehensive community-based rehabilitation hospital in Tanzania is working to cure women living with fistula and ensure that women have access to the care they need. According to UNFPA, the global campaign